Good day to our research professor, Miss Julia Pearl Brion, to the panelists, Miss Marinel Supnet, Mr. Jopet Osorio, Miss Mary Joy Talinting, and Miss Roselia Bayan. And I am Mary Ann Deriquito, and I would like to greet you all a pleasant day. We'll be presenting our research entitled Jollibee Health Sanitation and Safety Protocols During Pandemic in Calapan City, together with my group mates, Mr. Jexel Van Gerdose and Miss Annie Manibo.
Good day, everyone. We are the researchers that examine the Jollibee's health sanitation and safety protocols during pandemic in Calapan City. As the world adapts to a new normal due to the threats posed by the COVID-19 pandemic, many states shut down dining options at bars and restaurants. In spite of the pandemic challenges, food establishments must continue to operate as a necessity. So as these restaurants and bars reopened, proper restrictions and health protocols are designed and implemented to mitigate the risk of exposure to the virus. Fast food restaurants owners must follow safety protocols to make sure that the customers' food and the service they received are high quality. Jollibee is a Filipino multinational chain of fast food restaurants owned by Jollibee Foods Corporation or the JFC. Jollibee has been doing extra steps to ensure the safety of its customers, and this is imperative to protect food workers and prevent exposure to COVID-19. For obvious reasons, the food industry has always been required to follow strict health and safety regulations. But in the midst of the epidemic, there is a renewed emphasis on hygiene both in and out of the kitchen. Prioritizing good personal hygiene habits with staff is the key. Let me end this by stating, fast food service workers must know is that even a slight error in food safety compliance can result in a public health disaster that could result in not only a damaged brand reputation but the loss of human lives.
Given the existing situation in the city of Calapan, the researcher chose to conduct this study to prevent and lessen the cases of the COVID-19. The researcher aim is to know if the Jollibee is actually conducting safety measures regarding health and safety of its customer.
For the statement of the problem, according to the researchers, the fast food chain falls short of adapting the proper distance for each consumer, and additionally, the proponents noted a lack of sanitary practices as some tables are not wiped correctly and certain cutlery is not rinsed properly. Specifically, this sought to answer the following questions. What are the health, sanitation, and safety protocols practiced by Jollibee? How does Jollibee perform its safety protocols? How did these protocols be improved moving forward? This study aims to address the problem of social distancing and proper sanitation at Jollibee Calapan City. This study will help the following beneficiaries. To the Jollibee, this study will help Jollibee in the development of their health, sanitation, and safety protocols. This will foster new ways of enhancing knowledge and attitudes, thus preparing globally competitive employees in the future. To the employees, they will be given enough knowledge to practice the protocols of social distancing and right way of sanitizing their place. To the researchers, this study will be beneficial to the researchers through applying the proponents' knowledge of sanitation practices and broadening the researchers' knowledge of the topic. And also, this study will help the researchers practice working as a team. And to future researchers, this study would be a source of literature for future researchers who are into similar topics of investigation.
Scope and limitation. The research study respondents are the managers and employees who work in the aforementioned restaurant. The researcher will use quantitative research method and descriptive research designed to gather information.
Researchers will only conduct the survey on the managers and selected crews at Jollibee fast food restaurant in Calapan City, and nothing will be asked that is not related to the study.
According to Olaima 2020, all food industry organizations should strictly follow the protocols of food safety management system. Hand washing is a must in the workforce with the use of soap, running water, sanitizer. Also, social distancing is important today and should be implemented among workers as infected people may spread the infection. An US government website 2022 cites that institutions should comprise the sharing of information like FDA to the public. Personal hygiene is also discussed to amend the condition of food organization must be uploaded to the protocols given by the higher. According to the WHO 2019, food safety is everyone's business and responsibility. That's why FAO is helping strengthen the Philippines in this food business operation must implemented maintaining a food safety management system. Based on the HACCP principles, food business operators must also ensure that food handlers have received enough food safety training to allow them to do their job safely. In the website of TUV SUD Philippines 2022, it is essential for the food industry to ensure hygienic practices and traceability at every step of the supply chain to keep food safe for consumption. Food service operators were among the first workers in frontline employment sectors experiencing the impact of the COVID-19 pandemic. Therefore, cleaning, sanitation, good hygienic practices must be done according to this site. Foreign studies. In a study made by Dogan Gersoy 2020, customers were asked to indicate all of the safety precautions they expect to take place at dine-in restaurant posted COVID-19. According to him, the most important precautions customers expect from a restaurant are the observed physical distancing, visible sanitizing efforts like the use of sanitizer and alcohol, use of gloves, and well-trained employee. Studies of FDA 2020 employees should adhere to good sanitation and hygienic practices. They should disinfect and clean workspace and equipment, and consider more frequent cleaning of high-touch surfaces. Regularly self-monitor, take temperature, and assess symptomatics of coronavirus. In the study of Ace Morales 2019, the Food Safety Act obliged restaurants and other food establishments to strictly practice proper food handling and sanitation and also safety protocols during this pandemic. A study by Rosette Adele 2020 indicate that when the national government allowed the reopening of food establishments, fast food in Philippines intensified the safety measures in their operations amid the pandemic. In line with this, with proper action of employees, it will lessen and prevent the disease and the food establishment will get the satisfaction of their customer.
Theoretical framework. In theoretical framework, we have two theory. The first one is the CAP or the knowledge, attitude, and practice model. The second one is the health belief model. In the CAP model, it is believed by many jurisdictions that the CAP model is still most effective for an individual or an employee to learn and then implement at work the learned knowledge, attitude, and practice. The theory is based on sharing knowledge or information with them and develops towards attaining the attitude about it, and by then will continue to do applying the learning things in the work environment. HBM is a theory that states an individual will take action on a particular stimulus if they believe that it can harm themselves to an adverse and severe situation, and that taking action will set them to outweigh the code and barriers. Conceptual framework. It is consists of relevant variables in the study and maps out how they might relate to each other. In our study, it is consists of three pieces which are input, process, and output. In this figure, the input
process output model indicates the proper action to be taken for the pandemic condition to the present. The pandemic has changed everything we are accustomed to. We need to adjust and will probably maintain this setup as a standard of a way of living. In this particular sense, we will be implementing this course of action as the new and present standards to our environment.
Chapter 3, Research Methodology. Research Design. The quantitative research method was utilized by the researchers in the study to gather information of the present and existing safety protocols of the 4 branches of Jollibee in Calapan City. A descriptive research design was used in the study to investigate the in-depth phenomenon that existed within the Jollibee branches in Calapan. The descriptive research involved the collection of quantifiable and systematic data that can be used for the statistical analysis of the research study. Method of data collection. When the task of finding respondent is accomplished, the researchers then proceed with the administration of the survey questionnaire to the respondent and thoroughly explain the nature of survey so that the respondent will have an idea of what the study is all about. To accommodate the respondent, the researchers presented the survey questionnaire by sharing their screen online, considering that there is a prevailing pandemic and frequent interaction are limited. The researchers made a survey questionnaire and administered it online through Messenger. The instrument is presented and is also retrieved on the same day. Research Instrument. The instrument used is a research-made questionnaire as the primary tool for gathering data. The questionnaire provided for each of the rank and file and managerial employee of the 4 fast food chain was composed of 5-item close-ended question. Population and sample of the study. The population of each branch has estimated 30 employees and there are 4 branches targeted for surveying. 30 times 4 is equal to 120. The sampling techniques used by the researchers is non-probability sampling, purposive sampling. In purposive sampling, the participants are chosen based on the study's purpose. It is deemed suitable because researchers relied on their judgment or discretion in the chosen the employees of the Jollibee branches to participate in the study. Data processing and statistical treatment. The study used primary data collected through the use of survey questionnaire. Close-ended questionnaire are effective instrument of data collection in research because they enable the researcher to focus on important areas that address the research directly. The 5-item survey questionnaire were standardized to ensure the validity and reliability. After gathering the answer in the survey questionnaire from the respondent, the researchers then tallied and reviewed the result that they have collected. Calculating the provided data is done for easier counting. From the accumulated answer, the researchers are now able to evaluate their findings and interpret their gathered information.